Welcome to the Metta-Life podcast. I'm your host, Laura. Come with me on a journey to a healthy life. On today's episode, Martyna and I discuss the pillars of health. Martyna is a medical doctor, a health and fitness lifestyle advisor, and a yoga teacher. Since 2013, she has worked in different medical settings, including operation theater, intensive care unit, and other departments in Switzerland and Poland. She also teaches yoga, and she believes that lifestyle medicine is the future of medicine. She is currently the country representative of the European Lifestyle Medicine Organization for Switzerland. Welcome to the podcast, Martyna. So Martyna, could you tell us what is lifestyle medicine?
Yes, with pleasure. So lifestyle medicine is a branch of medicine which focuses on maintaining optimal health and also by prevention, treatment, but also even reversal of chronic disease. And it's also evidence-based approach, so very much like the rest of medicine, which means there is extensive research being used to identify the interventions that they have the biggest impact, and also just to verify which daily choices or which lifestyle choices are helpful in order to maintain health, but also, as I said, for prevention, treatment, and even reversal of chronic disease.
And what are the pillars of health according to lifestyle medicine?
Yes, so lifestyle medicine is based very much on pillars of health, exactly as you said. And then actually when it's kind of easy to even guess them, because basically anything that we do daily, any action that we repeat daily will accumulate over time and will impact our health. So basically what we do daily, we eat and exactly the
Thanks
one
God, we eat every day.
we eat every day, most of us, or don't. But anyway, the first pillar is nutrition.
Yeah.
Then the other thing we do or don't do again, kind of every day, is moving. So physical activity is the second pillar. Then the other thing that we do more or less every day, we sleep. So again, sleep hygiene, it's one of the pillars. Then what else? We have all kind of stresses of life that we have to face, and then exactly stress management. It's another pillar. Then we use or we don't use the substances, and then the impact.
When you mean substances, you mean drugs,
exactly.
Alcohol. Okay.
Yeah, exactly. So we call it substance use, but what it's meant by this is alcohol, drugs, these kind of things. So again, depending on if we regularly, frequently use it or not, it will impact heavily our health. So again, another pillar, it's the substance use, or rather avoiding the substance use. The other one, so we have the interactions with of other people, or we don't again. And so again, this social connection, it's another pillar of health. Then we live in a certain environment, and this environment over time will impact our health as well. So another pillar is environment. And then one more.
So environment is the air we breathe, the temperature in which we live, and things like that.
Yeah, exactly. And then it's quite still, the definition it's malleable. So in the most basic understanding would be the environment exactly as we live in. So if it's a city or not, the pollution level plays very important part, but also the exposure to nature, for example, or exposure to silence, we can put in this category, especially as there's growing research showing how important those are for our life. So we can include them, or maybe in the future create even more pillars as the more and more we discover. And then the last one, at least, or recognized, then depending on organization, sometimes there are small differences in what is considered being pillars. But for example, by the European Lifestyle Medicine Organization, one more important pillar is sexual health and fertility. Yeah. It's also there.
Okay. And so you practiced what we consider modern medicine for a few years. What made you switch to considering a more lifestyle medicine approach to your current practice?
Yes. So again, here we just need to emphasize that even though the lifestyle medicine is a growing field and research and all, then the regulations are different country to country. So, for example, in Switzerland, it's not yet fully recognized, so it's more seen like as health coaching. And then some other countries, it's more recognized. So then this changes. So just to clarify this, and then coming back to your question about. Like what made me change from like working more in the hospital setting into working more on the lifestyle choices that people do is actually the very work at the hospital that I did. So basically, I mean, even the very motivation to even study medicine was really to, I mean, I was very idealistic also at the time. It didn't change so much, and I really wanted to make the change and help people and so on and so on. Then the studies themselves were really interesting, though already back then I was surprised how actually little we were concentrating on the daily choice, or like on the lifestyle, like that would be there for every single disease as a risk factors. We would know that there might be impact, but we wouldn't concentrate too much on it. So you'd go to first straight away to pharmacology, which has its place, obviously, but it shouldn't be the only one. And then while working in the hospital, especially I would say the two, so the operation theater. So I spent a few years doing the specialization in anesthesiology and intensive care. And then what I've seen, like reading the medical records of most patients, actually most of these patients, they were suffering from chronic disease. So minority would be those who had accident or like something acute, but most of them would be the chronic patients. And then with chronic patients, now I know much more, and we have all the research that supports this, that actually, and it's very impressive research, that up to 80% of chronic disease are preventable through just our daily choices, so through all these pillars that we were just talking about. So what we do, what choices we make daily. And I remember, especially intensive care department, like looking at what they suffer from and realizing that they just ended up there because, like in many cases, not to put guilt, but just to realize, because we intervened too late. So basically, like the stay in the intensive care, it's super expensive, and it's like lots of very sophisticated technology. And already back then, I was having this reflection that if we invested a fraction of this money in those people years back, like to help them make changes in their lives to either prevent or treat the disease they had, then probably they wouldn't have to end up when they did. Or even same in the operation theater, like almost every night shift, what we would have, it would be amputations. And then amputations, like more about 70, more, even 75% or more cases of amputation in the Western world is the vascular disease and mainly diabetes. So which we know now by the research, then diabetes type 2, so we have to make a difference between diabetes type 1 and type 2, but type 1, which is the majority, and also it was majority of patients that I saw, is in 93% preventable with lifestyle changes. So, and I remember this was quite frustrating to see, like even the same patient coming back to just to amputate the toe, and then the whole foot, and then the higher and higher. So, and I like, back then it was not yet developed so much. There was no certifications and kind of stuff in lifestyle medicine. But I was already, I was thinking back then that would be the specialization of my choice if I could, to work on it. So then, I mean, it's a long path that I did. So we have limited time. But after I just made the choice of, at some point, like just stopping completely working in the hospital, then doing other things. And like to me, yoga, like it includes already some health pillars in it. So that's why, and then I started working one-on-one as well with people already through yoga. And this made me feel that that's exactly the direction I want to go, and it just got reinforced with time.
And if we are thinking about change, how does one implement change? Because it sounds fabulous. be mindful of your nutrition, be mindful of your physical activity, of your stress management, of your sleep. Okay, sounds great. Yeah. What does it mean in practice?
Yeah, exactly. And actually one part of definition of lifestyle medicine also, at least is understood by European Lifestyle Medicine Organization again, there's also part of it that I didn't mention before, is behavioral change. And then using behavioral strategies, again, evidence-based, to help implement this change. And then, like before implementing change, what I notice, it really depends on the person. That's why often like you work one-on-one with the person, and then during the process, it's not only about giving the guidelines, it's like do this, do that, like prescription. It's really about the understanding the person, understanding how they function, understanding how did they already do their changes in their life, and to decide together how to implement them. So one of the strategies, at least from the practitioner point of view, it's the motivational interviewing. So, and that's why especially the first consultation takes lots of time, because through the questions, you try to understand, not only medical history or general health status, but also how the person you have in front of you functions. So for example, for some people, the best, first they need to kind of build a new identity. So because we have, like, what prevents us from change is what we believe we are often. So if you decide, okay, I don't know, love chips too much and I just cannot go without, or whatever, like I love this junk food, then if you tried already some diets and you always failed, then you grow, and like with each failure, this belief, oh my God, that's who I am, I just failed, like in changing my diet. So you need to, like, in these cases, often you need to slowly rebuild the confidence in yourself. Yeah. So basically, by implementing small changes, you will slowly build, and especially with being accompanied at the beginning, so to help you with this push, you will slowly start growing this new identity of like, oh, actually I'm someone who likes, not only does, but actually likes like the healthy food. And then, so also we need to discover it. So the part of the change is also our beliefs that, health, like taking the example of nutrition. So the healthy food is like just not good and and having some bad memories from the childhood. So this has to also change. So you need to discover that it's not so time consuming, not so difficult to apply. And then also like buy small, easy, digestible pieces that you actually can accomplish day by day, then you grow this new belief identity about yourself. Mm-hmm. But then some other people, what they benefit more from is actually changing everything at the same time, like doing the big like challenge, let's say, and then taking a leap of faith for 3 weeks or 1 week or 2 weeks and deciding, okay, I give it a full try. Especially those where beliefs were completely like, they didn't believe necessarily in all these. And they decide, okay, I take the leap of faith for 2 weeks. I just change everything, and they have space and time, and because it's also, again, their personal situation. Not everyone can do it because of their work, their family, and so on. But if they can, and then they change everything at the same time, and usually after 2 weeks, they experience so much change, like they feel so much better, that they are motivated to continue. So it changes their belief. Again, it's a lot about beliefs, that by living, like following these recommendations, yes, they will live longer, but it will also feel longer. That they rather feel a bit not as long, but enjoy it. And then what they discover after these 2 or 3 weeks of this global change, that actually they enjoy more, that they have more energy, they feel better, they actually start to enjoy it, and then they are motivated to continue. Yeah. So it really depends on everyone's background or their beliefs, or their personal situation or their financial situation. It's really tons of factors that impact that.
I want to jump on something you said. You said change also depends on your situation. And I think it's important to acknowledge that we are not all of us, all of the time, at the place in our life where we can implement change. Yeah. For some of us, it will come easier because we have the financial possibility to do it. We have the psychological support to do it. And for other of us, if we need to think about feeding our kids or how we are going to pay the next bills, obviously it will get much harder for us to think about about our health, our environment, our sleep, etc.
Yeah.
So if there is one piece of advice you can give people that want, just try some change, what would you tell them? Where should they start?
Yeah. So then again, it's a little bit depends. So I would say what I would tell them to do is just looking, at all these steps, all the pillars that we just talked, just take 15 minutes of their time and 10 minutes of their time just to have a little reflection. And then think, okay, where do they feel themselves that they feel really that they would need change? So like, for example, usually it's like the first thing that pops up in their mind, that's the right one. So someone might look at this list and might say, oh, actually what I need the most, like the most urgent one, let's say, is nutrition, because it's really too much of, I don't know what. And then, so just starting there and just adding, a fruit to your breakfast, or like adding a bit more vegetables. So we know, when it comes to nutrition, there's people usually have very, very strong opinions about. But one thing that people mainly tend to agree on, that the vegetables and fruits are generally good for us. And then again, it's a big discussion about pesticides and all, but generally that's what we need. So implementing more fruits and vegetables, just a little bit daily, that will already make a change. And because they have lots of fiber, so they will feel more full, so then it will be easier for them to reduce something else.
Okay.
Or if someone looks at physical activity, that they really don't move enough, then if they live on the second or third floor, they can start walking up the stairs. This is something people usually don't like so much, but then they just go for a 10-minute walk. It's just very simple, starting small. That's what I would.
A few years back, I used to stay over at a friend's place who lived on the 11th floor of a building apartment. And every evening after work, I was like, okay, Laura, we're going to do this. I don't care how many breaks we're going to take, but we will climb up the 11 floors of stairs. And I would usually take 2 or 3 breaks or 4 breaks at the beginning. And by the end of the year, I just climbed them with my backpack and my working clothes. And I was so proud of myself. And I think those baby steps are usually more palatable and digestible than I'm going to climb Kilimanjaro tomorrow without any training.
Exactly. Yeah. Even 11 stairs can be too much. So if someone leaves just starting by 1,
I was already...
and then taking a leave, then maybe 2 after some time when they feel like... So basically, actually that's talking about the change. Many people have this... I used to be in this category, it's like 0 or nothing. And this is like very, very overwhelming. Because you are there and you aim there and you're like, you try, and then after a day or 2 you're like exhausted, and then you just drop the whole project. So basically, like, even if it's, I don't know, 1 plant-based meal per week, that's already good.
Yeah. And if it's not 11 stairs of flight, you walk the first one and then you take the elevator for the next 10.
Exactly.
Okay.
And by the end of the week, you already did like this one, this one stair that you did so many times. Gets multiplied and that accumulates, and then it impacts your health.
Yeah, and if someone wants to make changes to their sleep hygiene, stress management, social connection, sex, health and fertility, substance use and environment, what would your advice be?
Well,
one advice for each. Like if someone is like, oh, this is the department, or like the thing I want to change, like is my stress management, what would you tell them? Like where should they start?
Yeah. So stress management is a tricky one because there's so many aspects to it. So basically, again, I'm just thinking about like just one small, very digestible advice. And actually, I would say that you can combine a few at the same time. So like, for example, like because one of the stressors we have, like we are hyper connected.
Yeah.
So we are all the time getting notifications about this tragedy, that tragedy, reading news all the time. So just taking the time, and ideally, I would say in the evening even, like the time off your phone, And then actually you can combine it with many pillars. So you can make this time off your phone and then use it to go for a walk, and ideally with your friends. So then you already have 3 pillars.
I like it. While eating an apple.
While eating an apple, exactly. So you can make make a few changes at the same time.
Yeah.
Or you can have aiming at a few pillars at the same time. You can have a evening meal with your family, and you decide, okay, this one meal we don't use the phone, we don't have the radio going on, nor the TV, nor internet. We just spend this time like together eating and talking. So they have to create this connection. And then if it's the evening meal, then you can combine it with sleeping hygiene, because we know that exposure to the screen,
blue light,
just before night, it's one thing is just the screen and light it produces. The other one is all the news and all the activating and the agitating factors that we get with it. So if it's an evening meal, you can say, okay, from this meal on, like there's evening meal without the phone, and then I just don't touch my phone till the next morning, if you can do it. So that would be about the sleep hygiene. Or in the morning, just being exposed to the light outside, because for sleep hygiene, what is very important is circadian rhythm, which really helps us to optimize not only our sleep and generally function of our bodies. And what really helps with it, it's just the first thing in the morning to be exposed to more light. So then your body gets the information that it's the morning.
Yeah, when I can, because obviously we live in Switzerland, it's not always possible.
Yeah.
But I love to have my morning coffee on the balcony and just look at the sun and be like, oh, okay, I'm awake, I'm alive. Yeah. And I pet my dog at the same time, which is stress management.
Yeah, exactly. Or if you can convince your loved one to join you, or your partner, your kid, your friend, whoever is.
So one that I am confused about is environment, because most of us don't choose where we live. We don't choose if we are in a rural area or if we are in a highly polluted area. Yeah. So how would you suggest that we improve that factor or that pillar?
Yeah, that one it's tricky, because exactly as you said, sometimes we can choose. So if we have a choice, ideally we choose less polluted areas. Secondly, like trying as often as we can to actually, over weekend, like plan our weekends rather than in a shopping mall, like to plan, walk in the nature, walk in the park. Often it's not so easy because you take a public transport or a car, but as much as you can. And especially also if you live in a polluted area, then working even harder on the other pillars.
Okay.
Because then you will have the protective impact of other pillars against the pollution. And
it makes sense.
And it's completely, similar but different example as pollution. But there was this super interesting study made on the people which were survivors of atomic bomb in Japan. Yeah. It was a group which was exposed to the same amount of radiation, and then in 1980 they checked their diet and they followed them for 20 years.
Yes, I heard about that study. It's fascinating.
It's fascinating. And then they realized the dose, and then the only thing they checked, not on all pillars, it was only nutrition and only the intake of fruits and vegetables. And what they realized was that those who were taking the highest amount of fruits and vegetables had by 36% lower risk of cancer. So if we have absolutely no choice when it comes to pollution, at least we work even harder on other pillars. Okay. And whenever we can, we just go to be a bit more in the nature.
Okay. And then one last pillar I want to talk about is sex, health, and fertility. Yeah. I was surprised when I saw it, because usually it's kind of a taboo topic. Let's not talk about this. Only gynecologists and like very specific doctor get to talk about this. Yeah. So a few words about this. Yeah. What is sex life? Yeah. Or rather, what is a healthy sex life and fertility journey?
And like when it comes to sex and fertility, what is super important is that it's according to the patient or according to the person.
I love it.
So if someone doesn't have any sexual life and is fine with it, there is no issue.
Yeah.
So there's only issue if he's not fine with it. And then, so if it's his personal choice, that's his decision.
Sex life is also a sex life in itself. It's a choice not to have one.
But and same with fertility. So someone wants to have kids, that's his choice. And then we try to support him with actually also other peers. But if someone doesn't want, then that's not an issue. So basically, it's like defining what is the health in this aspect. It depends on the person. So what they want from this aspect of their life. And then if they want to increase their sexual life, or they want to improve activities, they want to improve their fertility, and then they are not satisfied with their current state, then there is a space to work to help them improve them.
Okay. An example. I'm very curious.
One example, for example, yes. So the very important one is erection. For the male side, and then here we again. So basically, all pillars they help each other, and then it's a bit of digression, but why is it so? Because all of them, they affect many different mechanisms in our bodies. So it's a kind of opposite to what. Not opposite, but very different in how we are used to think about medicine and medication, because medication, it goes towards the very specific mechanism. Here, the one intervention works on many mechanisms. So that's why each pillar helps each other, and then they grow together. So because they all impact our genes and genes expression, not genes the genes themselves, but genes only affect our life and they are expressed. So activated or deactivated, so they affect gene expression, they affect also the inflammation, chronic inflammation. Here we are talking about, and microbiome and oxidative stress and so on. So that's why when it comes to also fertility and sexual health, the other pillars are very important also to improve this aspect. And again, it can work both ways. So they can help each other, but they also can lead to degradation. So the problems with the sexual life and fertility can be a huge reason for lots of stress, and even the depression and mental issues and so on. So that's why, for example, taking this example of erection, we know and more that actually in this case, we are not only. So again, I'm just trying to find a way to find the right words. So again, we need to think wide when we think about our bodies. So for example, not okay, these organs is like this and this is like this. So for example, when it comes to erection, it's just the hydraulics, basically. It's the vessels.
Blood flows.
Exactly, the blood flow. So basically, if there is problem there, it's usually the early symptom of cardiovascular disease. Yeah. So when you have these kind of symptoms, you need to work on all the others, and here especially nutrition and physical activity, but also all the other pillars will come in help to improve this aspect.
Okay, may I please make an inappropriate shortcut for 1 minute? So if you want a good direction, eat healthy and move properly. Exactly. That's what you're saying.
Exactly. And I always as a great illustration of this, I always recommend documentary that I know you also know well about, which is The Game Changers.
Yes.
That it's great documentary, and then they really nicely show how erection, they actually do this experiment there, that they show that even actually one meal can impact the erection the following night because of the constrictions of the blood vessels. So in this case, nutrition will be very, very important, but not only actually all the pillars. And then again, if this aspect improves, which was a great stressor for the person, then we'll help with the stress management and so on. So it will be the virtuous circle.
Great. Well, Martyna, it has been incredible talking to you. We end every episode with a few burning questions.
Yes.
Are you ready?
Yes.
Okay. So the first burning question is, what do you want most out of this life?
Out of this life? That's a very philosophical question, which I don't know if I'm able to answer in one sentence. But I would say the most, I would say wisdom and peace. However, big words these are, but I would say that these two, they seem like a aim of life is to grow both. And they, again, help each other, I hope.
Yeah.
So that would be the two.
And now complete these sentences. The first one, the world needs more.
Would be easier, the world needs less.
Okay, why not?
Because I mean, the world needs less distractions.
I agree.
So we need more, focus and more, but not only like this productive focus when we are just super working, which is great and useful, but also just the peace, but the peace of mind. So just time alone, everyone, and I'm into meditation, so meditation ideally is the world needs more meditation, or if someone's not into it, at least some time alone, quality time alone.
Oh, I love it. And I'm grateful for
so many things. I'm grateful for tons of things. It's not the one. I'm very grateful for my partner, for the one that it's inside.
So for those who don't know, obviously because we are filming this episode, but Martyna is pregnant with a beautiful human.
Exactly. I'm very grateful for this pregnancy as well, and then for my whole family and friends and health, and the list could go on. So
endless list. I love it. And now the most important question of the entire interview. Are you ready?
I'm not sure if it's the most important.
Certainly not, but let's pretend. If there was one thing I could cook for you, what would it be?
Oh, there are so many great things you cook. I was lucky enough to be invited to lunches and dinners a few times already, and it's all very, very good. But if I would have to pick one, then I think, especially now, it would be this amazing miso soup that you're making with all the great stuff inside.
It's good for you and baby.
Yes. So I remember there is miso and then tofu and then lots of other stuff and the seaweeds and you make it really, really good. So the ingredients to some might not sound like, seaweeds or not, but it's super good. So
miso soup it is.
Oh, thank you so much.
Martyna, I appreciate you being so generous for your time. Thank you for being on the podcast to our listeners. I hope you pass down this episode to someone who needs it in your life. And thank you to everyone, and goodbye.
Oh, my great pleasure. Thank you.